we studied the adrenergic blocking drugs. The first chapter was that of the alpha-adrenergic blocking drugs, as there was the case that some drugs antagonize the effect of the alpha-1 receptors and the other cause the blocking of the alpha-2 receptors. The same way, the beta blockers are divided into two classes. These drugs causes the blockade of the beta receptors, both the beta-1 and the beta-2 receptors. Those drugs which antagonize only the action of the beta at the beta-1 receptors, they are known as the selective beta blockers. So these are classified then into two classes, that one, the selective one, which causes the blockade of the beta-1 receptors, and those blocking both the receptor beta-1 and the beta-2 receptors. These blockers are competitive antagonists of the sympathomimetic drugs, epinephrine or norepinephrine or other synthetic sympathomimetic drugs. Now, the following are the drugs which block the beta receptors. Now, the prototype of the drug is the propranolol. This is the prototype of the drug. The others are butolol, L-pronolol, Adrenergic, Bitexolol, Bunolol, Bisoprolol, Cardiolol, Carvedilol, Celiprolol, Esmolol, Levitolol, Metoprolol, Nadolol, Nebivolol, Oxprenolol, Pindolol, Prectolol, Sotolol, Timolol. These are the few beta-adrenergic blocking drugs. Then there are beta blockers which are selective in their action, that is, they antagonize the action only at the beta-1 receptor. It has got its own advantage, which we will discuss later on. So, in this, the acetylbutyolol, the specific for beta-1, then bitexolol. This is for actually beta-1. Then bitexolol beta-1, bisoprolol beta-1, carvedilol act on both the alpha receptor, alpha, beta-1, beta-2. The beta-1 also act on the alpha receptor, beta receptor, beta-1 and beta-2. Esmolol act on the beta-1 receptor, Butyolol also act on the beta-1 receptor. Nodolol acts on the beta-1 receptor. It has got the longest duration of action. Longest duration for about 24 hours, while the S-molol has got the shortest duration of action. Shortest duration of action. These are classified in these way into two different classes. Now, these drugs. Now, there is another property in these pharmacological actions of these beta-adrenergic blocking drugs. It is known as that these have got intrinsic sympathomimetic activity. Intrinsic sympathomimetic activity. This is also known, briefly it is known as ISA, intrinsic sympathomimetic activity. It means these drugs, some of these drugs have the intrinsic sympathomimetic activity, especially those drugs for acetylcholine and pindolol. These two. These have got intrinsic sympathomimetic activity, ISA. This intrinsic sympathomimetic activity means that these have got an inborn in inside this sympathetic activity. These have got sub-maximal activity of sympathetic activity. These thus behave into is number one, they will act as a partial agonist at the receptor, and these will have sub-maximal sympathetic response. In other words, they can also inhibit the actions of the sympathomimetic drugs, the epinephrine and norepinephrine. It means that they are both agonist and antagonistic activities, these drugs. Now, these drugs, these beta-adrenergic blocking drugs, antagonizes the activity of the sympathomimetic, that is of the epinephrine. For example, they antagonize the actions of the epinephrine or epinephrine on the cardio acceleration by acting on the beta-1 receptor. They will antagonize this action. They will also antagonize the action of the on the respiratory tract, where the beta receptor stimulants causes the bronchodilation. These will cause the bronchoconstriction. The sympathomimetic drugs also causes the hyperglycemia. It will antagonize that effect and will cause the hypoglycemia. Now, beta-2 stimulants also causes the vasodilatation in the skeletal muscles. These will also antagonize that vasodilatation and may cause the vasoconstriction in the skeletal muscles. Now, the action on the pharmacological actions of the beta-adrenergic blocking drugs, they will on the cardiovascular system, on the heart, they will decrease the force of the contraction of the myocardium. That is, they will have a negative inotropic effect. As these act directly on the SA node and the AV node, they will decrease the conduction in these tissues and will decrease the heart and will cause the bradycardia. Now, on the blood vessels, these drugs, by acting on the beta-2 receptors, they will antagonize the vasodilator action of the sympathomimetic drugs, especially the epinephrine on the blood vessels where they are dilated, and these drugs will cause its antagonism and will cause the vasoconstriction in the skeletal muscles. The action on the blood vessels and on the myocardium may be due to, number one, the blockade of the receptors. Number two, these drugs may cause the decreased release of the norepinephrine from the nerve endings, and number two, these will decrease the outflow from the sympathetic outflow from the central nervous system. Number three, they will reset the baroreceptors at the lower level. Action on the respiratory tract. We will talk about propranolol as a prototype of the drug. The action on the respiratory tract. Beta-adrenergic drugs causes bronchodilation. Now, these propranolol or these drugs will cause the inhibition of that effect and may cause bronchoconstriction. In normal persons, this action, this bronchoconstriction caused by the beta-adrenergic blocking drugs are not significant, but the person suffering from the lung diseases, for example, from the asthma or obstructive diseases, they are very much sensitive to the actions of the beta blockers, may cause severe bronchoconstriction, which have resulted many times in the death of the patient by asphyxiation. These drugs, propranolol, these drugs are lipid-soluble drugs, and they enter the central nervous system. They cross the blood-brain barrier and enters the central nervous system, where they will cause the adverse effects like the sedation, lethargy. Another effect will be that they cause some sleeping disorders. For example, patients may be having so many nightmares, Another weakness is that it causes sexual dysfunction. The cause is not known how it causes, but however, many people complain that these drugs causes the sexual dysfunction. These have got also local anesthetic effect, these drugs, local anesthetic effect, but these are not used as a local anesthetic because these are irritant drugs. On the metabolism, these drugs causes the inhibition of the glycogenolysis and lipolysis, and this way they will increase the concentration of triglycerides in the blood, and secondly they will increase the concentration of the very low density lipoproteins and also of the low density lipoproteins, which are dangerous, and also it will decrease the concentration of the high density lipoproteins, which are beneficial to the effect. Low density are increased, low density and very low density lipoproteins are increased, while the high density, which is beneficial, it is decreased. So it may aggravate the coronary artery diseases. On the skeletal muscles, these drugs antagonize the vasodilator effect of the epinephrine, of the epinephrine, and will cause the vasoconstriction. Thus, they will decrease the blood flow through the skeletal muscles, which will decrease the performance of the athletes by, number one, decreasing the blood supply, and number two, by decreasing the concentration of the fuels from the lipolysis and glycogenolysis. It decreases the fuel for the working muscles and decreases the exercise performance. In the eyes, these drugs causes the decreased synthesis of the aqueous humor and are used in the treatment of the glaucoma. For example, most commonly timolol is used. The others which are used are the bitoxolol, bitoxolol and cartiolol. these interfere with the synthesis of the aqueous humor. On the uterus, these drugs antagonizes the stimulating effect of the sympathomimetic drugs, beta-2 stimulants, decreases the activity on the uterus, causing relaxation, but in the normal uterus it has got no effect. Then these drugs also inhibit these drugs also decreases the level of the renin, and thus they cause the hypotension. In those persons which there is high level of renin and they are hypertensive, in it they can use the beta-adrenergic blockers, while in those hypertensive patients where the renin level is normal, diuretics are preferably used. Pharmacokinetics. Propranolol is absorbed from the gastrointestinal tract, but it is metabolized in the gastrointestinal by the first pass metabolism. After absorption, about 90% of it is bound to the protein. The rest is metabolized to glucuronide and are excreted in the urine. Indications where this beta-adrenergic blocking drug level. Most commonly, these drugs are used in two conditions. One is that in the treatment of the angina pectoris, where it decreases the force of the contraction of the heart, decreases the oxygen consumption. These drugs are used in angina pectoris in the prophylactically for long-term use in acute conditions. In the angina pectoris, the nitrites and nitrates are used for the treatment. These beta blockers are used prophylactically for long time. Other use, number one is the angina pectoris, number two is the hypertension, as we discussed later, and it is used in the treatment of the pheochromocytoma. It is used after the using of the alpha-adrenergic blocker. When you use alpha-adrenergic blocker, it causes vasodilatation there. If it is used without alpha-adrenergic blocking drugs, as it causes the contraction of the smooth muscles of the ear or of the arteries, of the skeletal muscles, it may cause a dangerous rise of the blood pressure. So it should be used, or it is used after the usage of the alpha-adrenergic blocking drugs. Then it is used in thyrotoxicosis, in which there is the tachycardia. It decreases the tremors and the tachycardia in the thyrotoxicosis, and it is very much used in the thyroid storm. In thyroid storm, when the patients are not treated or undertreated, thyroid emergency occurs, where there is a severe rise of the blood pressure and of the temperature and of the tachycardia and of the tremors. It may put the life in danger. So it is of very much help in this thyroid storm. Tremors of the thyroid or the essential tremors can be reduced, but the tremors of the Parkinsonism are not treated with it. In glaucoma, it is used by decreasing the synthesis of the aqueous humor. Adverse reactions are on the respiratory patient, respiratory system, where they will cause bronchoconstriction, and very dangerous situation may arise when it is used in the bronchial asthma. In those conditions, if it is a must that beta-adrenergic blockers should be used, beta-1 should be used, which act only on the myocardium, on the beta-1 receptors, and having little or no effect on the beta receptors on the respiratory tract. But even then, one have to be very much careful by using the beta blockers in these conditions. These are used in the cardiac arrhythmias, atrial fibrillation, etc. It is used in that. atrial fibrillation and atrial flutter. Another thing is that if the beta-adrenergic blockers are used for a long time, there is a down-regulation of the beta receptors, and if the beta-adrenergic blocking drugs are stopped very quickly, then there is a chance abruptly if its use is stopped, then there are chances of the fibrillation or the flutter or cardiac arrhythmias may occur if the drug is used immediately, abruptly. It should be withdrawn very much gradually. Metabolism, it may cause the hypoglycemia by inhibiting the breakdown of the lipids and those of the decreasing the breakdown of the glycogenolysis. In this way, they can lower the concentration of the fuel of the body, of the glucose, and in other words, it can antagonize reduce the physiological response of the epinephrine to the hypoglycemia, and the patient may go into hypoglycemia. Other use of it is that it is used prophylactically in the treatment of the migraine, not effective in the treatment, in the acute treatment of the migraine, but as a prophylactic, it is effective to some.